it's funny you mentioned the whole rewarding thing, because I think probably the most rewarding case I ever had wasn't even one of my patients. It was actually in an after hours clinic for one of my colleagues. And I remember thinking, how is this young kid, I mean, I say kid, but he's probably like in his 30s, but just a very fit, like tall guy, comes in kind of hobbling with an antalgic gait, just not looking well, the classic sort of sciatic gait, if you will. And he was describing this very intense acute low back pain and with radiation down the back of his leg. I'm like, what the heck? Did you have any injury? And I went through the history of them, and it didn't make sense, except for the fact that he'd been in a probably very poor posture for months studying for some examinations. And I remember just examining him briefly to rule out any red flags, and then just taking him through like 30 prone, so laying on his stomach on the examination table, lumbar extensions. And he was a strong guy, so he could really get to end range really well by doing this. People may understand it as like a lazy push-up, but it was more of a sustained, end range movement. And he after the 30, he sort of sits up, and I'm like, do you have any pain anymore? And he's like, no. I'm like, you don't have any back pain? He's like, nope. Do you have any leg pain at all? He's like, I do not. And he stood up and just sort of walked out of the exam room. And I was like, yeah, great.
Yeah.
So clearly he had a lumbar derangement because of his terrible posture over as, immobilized for the last like 3 months. His father was sitting there, was just like completely shocked, thought that poor guy was going to need all this therapy, so on and so forth. And I'm like, recommended the book, I discussed that, we could get him through to sort of musculoskeletal accountable care if he needed in the future, but he can perform these movements himself at home, even like 10 in the morning, 10 at night, whatever, 10 in the middle of the day, just to cut it, especially if he's been sitting so much like this, right? So he was just absolutely empowered, because he's like, oh, wow, like I'm not in any pain at all right now. And clearly he was a rapid responder. Some people aren't, and some people don't respond at all, which is a minority. But then at least you know where to send them potentially, whether they need like an epidural steroid injection or to see a neurosurgeon, et cetera. The list goes on and on for potential options after this type of algorithmic approach. But just that was probably the most rewarding case I've ever seen. I think about it all the time, and it's just, you don't get a case where you're like, I'm in terrible pain, and the person leaves in no pain. And again, I didn't put any words in his mouth. I'm like, oh, he's go down to 10%. Like, he's like, I don't have any pain at all. I'm like,
yeah,
great.
Yeah, it's like that. It's like that beautiful drive on the golf course where you hit it, it straight down the pipe, and then that's
300.
back.
Yeah.